Hello everyone, and thank you for viewing this demonstration of the Grifols Inclusive Kiro Fill. Kiro Fill is an automated compounding device for batch production of non-hazardous sterile preparations. It is designed to optimize operational efficiencies and enhance patient safety, while complying with all current regulatory and best practice guidelines. By incorporating new technology and automation into your batch compounding practice, you are ensuring a safer working environment for staff and higher quality products for patients. The efficiency and flexibility of Kiro Fill can help ensure your production demands are met now and in the future. Built on a horizontal laminar airflow platform, Kiro Fill has two robotic units that automate the most critical parts of the compounding process: aseptic fluid transfer from source to final container via lure lock connections, and automatic capping of final syringe product. All of this is done within an ISO Class 5 aseptic environment. Kiro Fill provides confidence in the accuracy and quality of every preparation produced through its controlled process, which is more efficient than traditional manual or semi-manual processes. Kiro Fill can produce over 150 syringes per hour. Quick change adapters provide flexibility to accommodate various final syringe sizes, including 3, 5, 10, 20, and 50 milliliters, and any fill volume from 3 to 50 milliliters. It supports source bags up to 5 liters and uses commercially available disposables. Barcode scanners confirm correct source bag and other materials are used. RFID tags are used to identify the correct source bag, and final containers are loaded into the correct positions and provide in-process tracking of components. Linear syringe pumps ensure high dosing accuracy every single time. Continuous monitoring of airflow, non-viable particles, and temperature allow control of the ISO 5 aseptic environment at all times. The automatic fluid transfer and capping of preparations in the ISO 5 environment reduces the potential for contamination during critical steps. Automating these steps also avoids the repetitive stress injuries that are seen in staff performing manual batch production of syringes. Kiro Fill generates batch reports to ensure proper documentation of the batch compounding process, including environmental conditions. Kiro Fill enhances patient safety by controlling the right drugs and materials are used, enhancing dosing accuracy, and controlling the aseptic environment during the compounding process. The automatic filling and capping of preparations removes users from critical steps and helps avoid repetitive stress injuries while allowing a productivity of up to 150 preparations per hour. Additionally, the traceability during the compounding process and the automatic generation of batch reports provides control over your production from outside the cleanroom and documents compliance with USP 797 and other sterile compounding requirements. The first step to prepare a batch with Kiro Fill is to select the template that will be launched using the user-friendly touchscreen. Batch orders can be stored in the device itself or received through an interface with your existing ordering system. Once a batch is selected, clear and simple on-screen instructions are displayed during each step describing how to proceed. The next step is the loading process, where final product syringes are loaded using the quick change adapters. RFID tags on the adapters ensure correct syringe size and positioning. Kiro Fill can fill 20 final syringes per run. A batch of 100 units will, for example, be compounded in 5 separate runs of 20 syringes. The next step is the addition and priming of the stock solution and loading of the tamper-evident caps. The user will scan the barcode of the source solution to make sure it is the correct drug for the corresponding batch. RFID tagged adapters are linked to the source solution and ensure it is correctly loaded. This allows maximum traceability while maintaining a high-quality process and preventing possible medication errors. The next step is to load the transfer syringes into RFID tag transfer syringe adapters, then load them into the device. Now that the loading phase is completed, the compounding phase will begin. The two robotic units work in parallel for maximum production efficiency. Each robotic unit controls a transfer syringe, which accurately transfers product from source bag to final container via lure lock connection Final capping is also performed by the robotic units at this time. The horizontal laminar airflow design of Kiro Fill maintains an ISO 5 aseptic environment throughout the loading and compounding phases. For additional quality control, a continuous particle counter monitors the aseptic compounding environment during the filling process to ensure the highest of quality for every single unit produced. The two automated robotic units will now manipulate the transfer syringes to complete the compounding process and cap the final syringes. Once 20 containers have been completed, the system will guide the user how to unload the finished products and load new syringes for the next run. The loading of new syringes and unloading of filled syringes can be done while the robotic units are safely working below, creating a continuous compounding process. This completes our demonstration for Kiro Fill. By attending today, you have shown the desire to be an industry leader, operating at the forefront of sterile batch IV compounding technology. Your commitment to safety and quality will help keep patients safe and create an efficient and satisfying work environment for your staff. For more information on Kiro Fill and to request a Grifols Inclusive representative, please visit grifolsinclusive.com.